Hi, so we have Dr. Kennedy here, and we were just talking a little bit about the stigma of diagnosis. And so I wanted to ask him, I asked him, what is one of the things that's helpful? And take it away from there, Dr. Kennedy.
Yes. So I can remember being in college and having a hard time dealing with some emotions after a breakup. And I remember talking with my parents about it, like, oh, we'll set you up with this therapist. And I just looked like a deer in the headlights of, oh, no, no, no. And I'm not going to be on pills. And I don't want to see any therapist. And it was just more of the fear of the unknown. And when I started to read and learn more about what was actually going on, that helped me get started on that journey. It really took finding a specific therapist who I felt understood me and wasn't just pressing a tape recorder and wanted to analyze me. So having someone who was a therapist or a psychologist or a nurse, social worker who takes the time to listen to you and understand you is one of the most valuable things I think a patient can feel, and really is the foundation to helping people get started on treatment or understanding what their difficulties are. And that's how my story got started when I was 19 and I met uh, Dr. Brown, who helped me understand a part of myself that I didn't even realize. And having that addressed was not so much a burden up front, more of a relief. And it sort of was a total paradox to how I thought about mental health from that first story about the whole therapy freak out.
So beforehand, how would you have described your thoughts around the therapy beforehand, and then your thoughts around therapy afterwards?
I think a lot of my feelings towards it was based on movies I've seen. Uh, for example, with Good Will Hunting, and I just thought, like, this has got to be such a joke where you're sitting on a couch and some guy who doesn't even look at you is asking you a bunch of weird questions. Why am I going to do that? That sounds strange. Uh, in my own family, there wasn't a lot of talk about mental health, so I didn't have people to go and to ask about those sort of things until I got older. And then people started coming out of the woodwork, and grandma started telling me about how her journey of psychoanalysis and therapy. And I was like, what? I didn't know you guys were hiding all this information from me. But I think having adults learn how to share it with kids so it doesn't seem scary at an early age helps you learn, oh, this is a tool I can use at any age. It doesn't have to be a scary thing.
Do you think that's a similar experience for many people that come to see you these days too at the Brown Clinic?
I do. It's interesting when I approach the subject with people because sometimes I'll ask questions and I'll get some answers, ask them another level of question, and after about half an hour, it's almost time for the appointment to end. And I was like, "So, how'd you like your first therapy session?" And they're like, "What?" And I was like, "Yeah, it's not. It doesn't have to be anything too complicated or whatever you imagine it is. It can be like this." And I think helping people realize that it's not so scary helps people sort of buy into it. Um, and I share people they if the patient's comfortable with my self disclosure, I don't share every little detail that they need to know or uh, what I want to share. What I want to share with patients is enough to help them feel like this. I was the worst patient. I didn't want to share anything, and I did it, and I've been through it for about. At the time I started when I was 19, I did for 3 years for an hour a week, sometimes two times a week. I really got an understanding of myself. And that was the most valuable treatment I think I would ever have had, is having
Mhm.
someone to listen to me.
And then what became possible for you? So what's more of what doors do you think that opened for you that might not have been there before?
It made me a happier person generally, because anytime something bad happens, things in life happen, and how I dealt with it before was this analogy my therapist said of sweeping things under the rug, of basically not dealing with things. I'd rather, I don't know, maybe I got it from my grandmother, who was very stoic, and she just had a stern look to her face. Nothing bothered her. But uh, that I learned was not a very good coping skill for myself, because it would usually end up in a bigger problem down the road. So learning coping strategies, learning how to ask myself and think, why am I feeling this way? Or reaching out to other people in my family, and when they recognize something about me that's different, to tell me. Because sometimes we don't even know ourselves, but we're in this sort of mood. So I think just generally having some skills, coping skills, and knowing that it's not something that you have to be afraid of addressing.
Mhm. So clearly that was beneficial for you, as now you help other people on that same journey. So what have you seen change in somebody's life?
I think what some people initially feel is, wow, I, I can't believe this. I've been dealing with this my whole life, especially people that get older, and how successful some people really were. Sometimes the illness of bipolar ADHD isn't all that bad. It does come with positives. There are negatives about the disorders that can really weigh on you and cause a lot of hurt. But there's a lot of benefits to the disorders, like creativity, being outgoing or extroverted, etc. So emphasizing those strengths in people, I think, is really important. And I've seen people change their lives completely of how they feel about themselves. I think seeing someone say, this is the first time where I feel like I'm happy. And I never felt that way before, or I've always struggled with feeling different. And now it's nice to have some clarification. It's nice, it's the nature of the disorder that comes and goes, but seeing a different side of yourself, that yes, I can be productive. Yes, I can be just like everybody else in my class or at work. It doesn't have to be like the old way.
Mm-hmm. So tell us a little bit about your practice and what we can know about that.
So in our clinic, we see patients as youngest is 3 years old up to, I think, 93 was my oldest patient here. Most people are fit, in between 5 to their 40s, but we see all ages of people, and they come in here for a 3-hour evaluation. It's psychological, but we use ADHD rating scales, some cognitive testing to assess memory, and if there's something else going on, then we can assess for that as well. And we spend a lot of time just asking a million questions to understand who the person is, what's been going on in their life, and sharing our impressions, and spending enough time for psychoeducation before even talking about our treatment. I want people to really understand what's going on, and people in their family to understand what's going on. And then for our treatments here, a lot of patients like to do medication treatment here. That's my specialty. And I've learned how to fine tune and individualize medicine that a lot of other doctors may not have the time to do. We have the luxury of having 1-hour blocks of time for patients for appointments. But it's sometimes it's me and Dr. Brown together for a family. So we often have family sessions, or we have couples, little kids, and we do it by Zoom, or they come into the office. So the combination of sort of our training together, we have a pretty comprehensive treatment package for people.
That's awesome. So for the family that is feeling a bit trepidatious about coming in and they're uncertain, what would you say to them as they are taking that step, perhaps even despite feeling trepidatious? Or how would you help them or encourage them to even take the step to come?
So we have this little technique I use of circles and squares, of giving people a picture, and I'll draw it in front of them of, here is all your strengths, and here's some of your difficulties that you have. And in your difficulties, there's this thing called bipolar, or there's this thing called ADHD. And it's, for most people, it comes and goes throughout the course of their life. It's rare for some people to grow out of it, but for those, they're lucky. But just, starting from there and to getting an understanding of how it fits with them, but balancing it with the things that they're good at. There's more positive and great things to appreciate in people than the stigma of mental health. So trying to help people not feel ashamed or feel guilty for this information. For some people, it's a burden. They're like, oh, now I have to deal with this and I have to take medication. And for some people, that takes a while for some people to get around. For others, it's a huge relief. But finally, I have a label to something. So getting people to understand themselves better and not feel like they're a disorder, but it's a part of the bigger picture of them.
It's a good message. And what I enjoy is that it's not going to feel as scary to come and speak with someone like yourself, because I feel like a lot of times people are just afraid to face any negative side, and that fear can keep someone from getting help. So having you share like what the balance is that you start off of the bat, I think that helps to reduce the amount of fear and anxiety from coming in. So thank you very much for sharing that. I appreciate it.
Well, a lot of our patients have come to see us after watching or reading some of our work. On our website, we have links to a ton of free articles to download and read about ADHD. If you scroll all the way to the bottom or just go on YouTube and type in Dr. Brown's name, there's this 28-minute primer video by Understood. And a lot of people have watched that and said, I'm making an appointment with him. This is me. So again, I think people learning first about what it is before coming in here helps them motivate them to seek help.
Awesome. Thank you, Dr. Kennedy, for being here and sharing a little bit about the Brown Clinic and your links. What web address can we find you at again?
At brownadhdclinic.com.
Awesome. So that'll be linked in the show notes below. And great to speak with you here. Thanks for your service for families.
Thank you. Glad to be here.